Hi, this is Dr. David Tenner. We're here at the Goldberg Clinic where we specialize in chronic disease reversal, and today we're joined by Ms. Roberta Onken. And Roberta is originally from Brazil, moved to the United States and Georgia about how long ago?
About a year ago.
About a year ago, okay. And Roberta came to see us originally in November of 2016, so about 6 months ago. And she had just, when she came to see us, she had just gotten out of the hospital. She had had an episode of gastrointestinal problems. Roberta, I'm going to turn it over to you. What was going on at the time and what originally brought you in?
Yes, I had a very bad episode of inflammation. So I had to be hospitalized for 4 days to take antibiotics. I actually had an abscess in my intestines and a lot of diarrhea and a lot of vomiting. Before that, I used to have episodes where I would have stomach pain and vomiting, and I always thought it was stress related, so it would last 1 day, and then when I went to the doctor after that, I would be fine. And I did a couple of endoscopies along the years, and they didn't show anything. So, but this time it got worse, and I had the diarrhea, and so I had to be hospitalized.
Okay, so in the hospital, some pretty significant concerns there. And what kind of diagnosis did they give you while you were there?
When I was in the emergency room and I did a CT scan, and they told me I had Crohn's disease. And it surprised me because I never had any symptoms like that before, and I never heard about,
Well, we know Roberta was having quite a lot of inflammation. She had brought in some lab work that she had performed, and her C-reactive protein, which is a measure of inflammation, was very high. It was about 123, and normal, I think, is less than 5. So she was very inflamed, and you actually found out about us through Ginny Patel's website.
Yes, right after I got out of the hospital, the doctor told me to read about Crohn's disease, and then go back to see him after a few weeks. To decide what medicine I was going to take. And so I did a research. I didn't like what I read, and then I was researching more, and I found Ginny Patel's website. There was a video there was like an hour and a half, I think the 8 steps. So I watched it, and during the video she mentioned the Goldberg Clinic, and because I live in Georgia, and she said I was in Georgia, and so I went online. This was a Saturday. On Monday I called, and that week I was here. So I actually came here before I started any other treatment.
Okay, yeah, and for our audience, Ginny Patel Thompson's a very bright woman. She has a website called listentoyourgut.com. It's a very good website that has a lot of educational materials for patients that have these kind of inflammatory bowel diseases. And she's done a few interviews with Dr. Goldberg, which are on her website and are available for viewing. So thankfully, Roberta found our clinic, and she came in back in November after she had been in the hospital. And we've been working with her diligently to address some of the causes as to what led to the development of this over time. And have been working with her and put her on a program. And it's about 6 months later now. Roberta, tell our audience a little bit about what's changed for you now.
I'm feeling very well. I haven't had any symptoms since I've started the treatment. I had to change my habits. I had to change my diet. I had to stop drinking coffee and wine every day. But that was a very positive change, so I don't miss it that much. I've started exercising more. I'm paying attention. Even now that I feel great, and it's hard to follow the diet, but I'm still following it, and so I didn't have any symptoms in the last months. I know I have something I cannot abuse, but since I'm paying attention, I think things have been great.
Roberta knows that now that she's feeling better. Her inflammatory indices, by the way, are entirely normal now.
Yes.
And your recent MRI showed clear of all inflammation. The whole thing looks good, and she knows that she's going to have to continue taking good care of herself so she can maintain these good results. But the good thing is Roberta, you know, she came in, we've educated her as to what's caused her problems and got her on track with a program designed not to treat symptoms, but to build health.
Yes.
And we've also taught her now what she needs to do so she can keep herself healthy and prevent herself from having a reoccurrence. So we're delighted with the results that we've had. We're going to continue moving things in the right direction.
Yes.
And we very much thank you for sharing your story with our audience today.
You're welcome.
Thank you.